seizure is defined as a transient occurrence of symptoms and or signs that is due to abnormal, excessive, or synchronous neuronal activity in the brain. So you've got a whole lot of neurons that have got overexcited about something, and they're causing a signal to go throughout the brain in a synchronous way. Epilepsy is defined as a change in movement, attention, or level of awareness that is sustained or repetitive and occurs because of abnormal and excessive neuronal discharge within the brain. So the common terms that you will encounter while we're speaking about all of this would be ictal, and this is, ictal, pre-ictal, post-ictal, tonic, not that tonic, and then atonic, clonic, myoclonic, and our provoked seizures. So ictal is just relating to a seizure. Pre-ictal is the period of time just before the seizure. Like, I have no notes, so it doesn't matter. Like, is that all right? Like, sorry, I'm fighting with Microsoft Teams at the moment. So, okay, great. And then our clonic is so tonic is the sudden stiffening of the muscles. Clonic is the repetitive rhythmic jerking of the limbs. Myoclonic is brief sudden jerks or twitches. And then we talk about a provoked or an unprovoked seizure. So provoked seizures are due to an identifiable, temporary reversible factor. So now we're going to speak about the epileptic seizures themselves. So the diagnosis is made clinically, kind of mostly. So often we rely on eyewitness accounts. We speak about the history, we speak about the signs and symptoms, the behaviors, and how this is occurring before and after the seizure, and also observation by a healthcare practitioner if a patient might be in an emergency setting or something like that. These are then classified into different seizure types. So you've got focal seizures, generalized seizures, and unknown seizure types. Focal, as the name implies, is it arises from a specific focus in the brain. This seizure can then generalize. It's generally not associated with a loss of consciousness, but we classify it according to the degree of impairment in consciousness that's occurring within the patient. Then you get generalized seizures. This is where the seizure activity arises and rapidly spreads, involving both hemispheres of the brain. And there's almost always a loss of consciousness of some sort. And if there's an unknown seizure type, here you basically just don't have enough information yet to decide on what the label should be. So the presentation is unclear, and it could be a placeholder until you find what the diagnosis is or the seizure type is. So this is just kind of a picture of the generalized seizure jumping all over the brain and our focal seizure in one part. So no epilepsy presentation would be complete without the International League Against Epilepsy 2017 kind of definitions of seizure types. So here they basically speak about the focal, generalized, and unknown seizure types and how they relate to the epilepsy diagnostic types. And then these going through to the epilepsy syndromes and all the way through considering, as you can see on the left, the comorbidities that a person has, as well as the etiologies that could have given rise to the seizures and to the epilepsy. So with focal seizures, normally you'd have preserved, they get differentiated into preserved and impaired consciousness, an unknown state of consciousness, or a focal moving towards a bilateral tonic-clonic seizure. So with focal preserved consciousness, the patient is aware throughout, and the symptoms that they experience depend on the area that's involved, basically. So here, remember, you have a patient that's awake, they don't have much impairment of their level of consciousness, and they may get all sorts of things like a somatosensory problem, somatosensory. There may be focal motor aspects depending on which part of the brain it is. You can see in blue, there's the kind of a motor cortex, but you can also get autonomic aspects like sweating, flushing, or pallor. And here they could actually also get visual or auditory stimuli. So to kind of differentiate this, if you've got focal seizures with impaired consciousness, here they speak more about fully formed visual hallucinations. So they didn't really mention hallucinations in the first one with the retained level of consciousness, but in the impaired one here they talk about having full kind of hallucinations and more the psychomotor phenomena and your impairment of consciousness. So when you've got focal seizures that then generalize, again, these are still arising in a specific focus and then progress to involve both hemispheres. And the differentiating factors here, there's often a preceding focal sign and then an aura. So here basically it just kind of shows the focal seizure starts in one area, it moves down to a separate area and then jumps around the brain, eventually involving the whole brain. So generalized seizures. Sorry. Blah, blah, blah. Sorry, let's just see. Yeah, okay. Good. So generalized seizures, you basically get broken down into generalized motor seizures and absent seizures. So motor seizures, you get your generalized tonic-clonic seizure. This is the one that we often see. It's the most obvious, kind of overt one. Here we've got there's the aura stage, the tonic stage, the clonic stage, and the post-ictal stage, right? Aura is anything that the person might experience before the seizure comes. Some people say that they can sense that it's coming for whatever the reason might be. In the tonic stage, you've got the stiffening of the body. This is where the patient might experience incontinence. Their back might arch, and they might experience what's termed an epileptic cry, which is where, because of this, the muscles all kind of stiffening, you get air pushed up past the larynx and the vocal cords, and you get that cry out or that moan. In the clonic stage, that's when you've got the jerky rhythmic motions, blinking eyes, and then post-ictal phase, there's kind of weakness of limbs, and they're sleepy and feeling exhausted. So the generalized tonic-clonic seizures are alarming. They're dangerous because of the seizure and the body motions themselves. So the person may fall, they may injure themselves, but also there's an increased likelihood to progress to status epilepticus in the generalized tonic-clonic seizures. And here it's always important for education, for family, for friends, the healthcare workers, and the patients themselves. Absent seizures, this is an abrupt loss of consciousness. They may not have any fall or overt signs that occur. There may not be any pre or post-ictal phenomena, and it's subtle and can be quite difficult to diagnose. This occurs more commonly in children, and some kind of suggestions for clues about when this might be happening is that the school performance might be kind of worsening. There may be blank or staring moments, or they're not responding to questions. So the seizure types in summary, you've got focal, you've got generalized, and we talk about the arising from a single focus and generally no loss of consciousness in the focal, and generalized from both hemispheres, and almost always a loss of consciousness of some sort, but can be overt or subtle. So why is it important? Why have we taken time to go through all of this?